A lot of patients this period also complain of inflammation of the plantar fascia and the Achilles tendinitis. So this picture shows a plantar fasciitis, where there's a lot of pain over the sole, and this picture shows a Achilles tendinitis, where there's a lot of pain over the heel. Okay? And the pain is commonly in the morning, and most of them will say that I get severe pain in the first step upon awakening, and that's very classic of the plantar fasciitis. And a lot of times it's also because of the change in our working environment. So I always tell the patient, in the past we spend 8 to 10 hours in the office or working environment with wearing shoes. But now when we're at home, most of us Asians, we do not wear shoes, so we are walking barefooted. So now the feet has to take the stress, additional 8 to 10 hours a day. Okay, so that is, I think, one of the causes of why I'm seeing more plantar fasciitis and Achilles tendinitis. Other causes include tight calf muscles, overuse, repetitive trauma when you're walking at home barefooted 8 hours more than usual, obesity because of the increased load over the feet, poor shoe wear, of course. So again, over-the-counter treatment, if it doesn't go away, do see a doctor. Sometimes, most of the time, we'll start with the x-ray. So a lot of patients always ask me, where is the spurs? Okay, so look at the x-ray on the bottom. So this is the side view of the ankle. So this is the ankle joint. Here will be the leg. This will be the heel, and the toes will be in front here. So the toes is here, the heel is here, and the pain is always at the sole here. So this is the bone spurs for plantar fasciitis. But for Achilles tendinitis, the bone spurs will be at the back here. Stretch, stretch, and stretch. So I always ask the patients to stretch 3 times a day, 15 minutes each. And I always advise, teach this method because it can be done easily anywhere with a step. So you just have to keep your knee straight, put your foot on a step, and then you lean forward. The buttock should lean forward, and you should feel the stretch at the back of the legs all the way down to the heel. If you don't feel the stretch, you're either bending the knees or your buttock, or you're leaning your body instead of your buttock forward. So do remember, knee straight, buttock forward, okay, not the body. And then you feel the muscle at the back, a lot of tension in the muscle at the back. And if you don't feel the tension, then you have to relook at the form and correct it. I always tell the patient just to wear a pair of shoes at home, anything, sandals or slippers, anything. And when you go out, get a good pair of shoes with thick heel pad, okay, so that instead of your heel, your fat taking the pressure, the heel pad will take the pressure. Frozen water bottle massage, this is my favorite. So I always ask the patient to freeze a bottle of mineral water, put it on the floor and roll it when they're having breakfast before they go to work, and when they are home, when they have dinner or after dinner when they're resting. And wear a pair of socks when you do that, because I don't want a direct contact between ice and the skin, because it will damage the skin. The fact that it's cold means it will reduce inflammation, and it's hard, so you will have a massage function. So sitting, what's the problem with sitting? So sitting is actually really quite bad, because the moment you sit down, the calorie burning actually drops to 1 per minute. Okay, and the good cholesterol actually drops by 20% after 2 hours. And amazingly, it actually affects the insulin. That means the risk of diabetes actually rises after 24 hours of sitting. And over time, there's a lot of blood pooling in the legs. This is like the airplane disease. So a lot of times we ask the patient to get up. Okay, so everybody can take a few seconds, get up now and stretch. Okay, but don't switch it off. Okay, I'm going to continue. Okay, start stretching. This is very, very popular. So when I was in the States, when I was training in the States and the UK, I can see the admin office. A lot of people are using this standing desk, but I think it's not so popular here. Maybe not in the hospital. Okay, maybe in the private company. But you see, is this a solution? But this is not a solution because they are not using it correctly. So as you can see, the elbow is not 90 degrees and the wrist is not in line with the desk. So you can see, especially the wrist here, there's a lot of pressure. This is what I mentioned. The wrist is on the desk. There's a lot of pressure in the carpal tunnel. Okay, and then the screen is not at eye level. They are actually looking down. So it's not going to help at all. You may as well just sit down. Okay, so it's not ideal. Okay, if you want to do it, again, the ears, shoulders, and the hip should be a straight line. Lounge chair, I think this is very tough. This is really, really tough. I think at home when we have a sofa, it's very, very tempting, but the neck will hurt after a while because it's constantly looking down. For the brave and very fit, we can have a treadmill working station. But to me, this is more for leisure, maybe YouTube, watching Netflix. You know, I don't know how productive it is, and whether is it risky and dangerous. So just be careful. For people with very strong core muscle, they can do that. I think it's good to offload the joints, and if you can do that, I think your core muscles will be really, really strong after a while. So again, this is important. Step 1, ears, shoulders, and the hip in a straight line. Step 2, adjust the armrest before everything else. Step 3, adjust the height of the chair so that you can slide it in, okay? So when you're in this position, after step 3, your chair height has already been determined. So the step 4 is to adjust the height of the monitor. And then lastly, check for the footrest. Writing posture, the same thing, everything in a straight line. So the straight line should be when you look from the back and when you look from the side. So a lot of time, if you are into a lot of writing or designing or write, you may need to get an ergonomic table to help with the posture. Walking, same thing. Everything we are doing, we always emphasize the ears, shoulders, and hip in a straight line. Lifting, again, commonly we always tell the patient to bend the knees and not the back. Bend the knees and not the back. Because when you bend the back, the load becomes further in front. Okay, so I mean, the moment arm becomes bigger and becomes very strenuous on the back. Driving, the same thing. Sit straight, ears, shoulders, and hip in a straight line. Handphone, this is very, very common. So most of us will be doing this, right? I mean, we'll be looking down. Okay, so again, the more you bend down and look, the further your head is away from the spine, and the moment arm increases, they increase the stress over the muscle at the back. So it's ideally we should be straight and using the handphone straight up, but I mean it's very, very difficult and it's very tiring for the arms. But it just means that we shouldn't be using it for very, very long hours. Okay, so just bear in mind this picture is important. If you have neck pain and you feel that it's not going away, this may be the culprit because we are spending a lot of time on the handphone. So what are some of the red flags that we need to watch out for? So if you have night pain, that means pain that wakes you up at night, pain that stops you from sleeping, and pains that wake you up earlier, these are not good symptoms. Okay, they are symptoms and signs of like tumor. If you have rest pain, again, you're not moving, you have pain, okay, which is not common. So you may have infection. You have loss of weight, loss of appetite is a common late features of a tumor again. And you have fever, shivering, and you feel cold with back pain, we are always worried of infection. So if you have these symptoms, consult a doctor, because over my last few slides, I've been saying treat over the counter, but I think that's not the solution if you have all these red flags. So I think the talk is coming to the end. I mean, I've emphasized a few things. So the take-home message is the ears, shoulders, and the hip in a straight line. Okay, and the red flags are important. So if you do have them, do seek treatment. And when you see a doctor, most of the doctor will step up the treatment slowly. So no fear, no doctors will offer you surgery immediately unless it's really, really, really necessary. Okay, so always adjust the posture. As I mentioned before, sitting takes up 8 to 10 hours, and another thing is sleeping posture as well. So combined, it takes up about 80% of the time. Okay, so sleeping is the same. It should be a straight line. When a patient asks me whether I should get a firm mattress, soft mattress, thick pillow, thin pillow, doesn't matter. So long it's in a straight line when you lie down, okay, and everything should be fine. Okay, so if you settle your sitting posture, if you stretch regularly, if you have a good working station, and if you watch your sleeping posture, everything, you should get better with physio and treatment. And very rarely do we end up with injections or surgery. Okay, but if we need to, we will explain to you that why is it necessary.